Hi, I'm Vivian Nabeta, founder and executive director of the Sonia Nabeta Foundation, a nonprofit that believes in an Africa where children with type 1 diabetes have an equal chance at long, healthy, productive, and gainful lives.
And I'm Elizabeth Feaster, the founder and executive director of T1 International, a global patient advocacy organization led by people with type 1 diabetes. Our organizations believe in the power of advocacy and that we're stronger together. We know the impact that small grassroots organizations can have, especially in humanitarian settings.
Together, SNF and T1 International, we run the Pamoja Advocacy Program, which equips young Africans with type 1 diabetes with a community, the tools, support to carry out time-bound advocacy plans to make change in their own communities. COVID-19 has impacted communities worldwide. Country lockdowns and curfews made access to essential medicines exceedingly difficult. In these videos, you'll hear from four of our Pamojan advocates from Ghana, Kenya, Tanzania, and Uganda about their challenges amidst COVID-19 and their daily struggles with type 1 diabetes.
We believe that access to insulin is a human right, and we believe in the power of patients and in small organizations to improve the lives of people with diabetes in humanitarian settings and everywhere around the world.
My name is Emmanuel Kisembo. I'm the Programs Manager, Special Initiatives at the Sonia and Nabeta Foundation. I'm also a Pamojan advocate. I've had type 1 diabetes for 8 years now, and I live in Uganda. I'm a Ugandan. In Uganda, type 1 diabetes is still a very big mystery, and the diagnosis can really be challenging to all. Our health infrastructure is not so developed. Our medical workers are not very knowledgeable about diabetes, and diabetes is also not on the radar of policymakers. Our data has revealed that warriors travel up to 6 hours round trip to medical centers to pick supplies, and the largest part of this journey is on foot. The COVID-19 pandemic worsened these challenges. Our lockdown here in Uganda comprised of a total ban on transport. Warriors found it very difficult to move from home to health centers to pick supplies. Schools were also closed, so warriors went back home, and some of them were working on farms with their parents. That meant hypos, frequent hypos. The Sonia Nabeta Foundation mounted a network of motorcycle taxis, also known as border borders, to help bridge this access gap and solve the transport issue during the lockdown. That way, warriors would still receive their supplies delivered to them at their homes. We also had a diabody system where we were connecting with our warriors. We had a call up a warrior Saturday where we would pick up a phone and call a warrior and check on them, see how they're faring. And that also helped our warriors stay in touch with one another. There is one warrior who had a problem with mental health during the lockdown, and I had to go and see them and try to talk to them. But transport was an issue, so I had to disguise myself on a pickup truck because it's only cargo transport that was allowed then, to go and see him and talk to him. But luckily, I was able to reach him and we solved the problem. The COVID-19 pandemic has not really been easy, but that is how we've been able to navigate these hard times.
Hello, I'm Yabipe Amwa. I'm a member of Pamoja Team Ghana. The COVID-19 pandemic situation has caused and is still causing a big scare all over the world, especially with people living with chronic conditions such as myself, type 1 diabetes. In Ghana, most of the type 1 diabetics get their insulin from the government hospitals using their national health insurance. This means that they will have to go all the way to the hospitals to get their supplies, which actually increases the risk of them getting the virus, especially when there's a crowd of patients around. But with us in Team Ghana, because of our association with Diabetes Youth Care, which included doctors and nurses, we had the opportunity, or we were privileged, to consult them online and on phone calls, which of course is not the case with people who were not members and people who were living in the interior areas that didn't have network. We were asked to stay at home and went out only when there is necessary and when there's emergency cases. So it meant that our routine labs and our routine checkups were not done. We only go to the hospitals only when we had emergencies, which is not really good for us living with type 1 diabetes. Unfortunately, some pharmacies increased their prices of the diabetes supplies and insulin because borders were closed and goods were restricted, so which was hard for us who get our insulin and diabetes supply from the pharmacies. We also advised to stock up at least 2 weeks of supply of insulin and injections and whatever supplies we needed, which we did. At a point in time, the government hospitals had limited amount of supplies of insulin, so it means that we had to go to the pharmacy to get it at increased prices. Living at these times has been challenging. It means that we have to decrease the risk of emergencies. We have to be more responsible. It's quite interesting and again challenging. So we pray and hope that this pandemic or the COVID-19 situation goes away so we go back to our normal lives. Thank you.
Being diabetic is a very challenging thing. Having COVID around is the worst. Here in Tanzania, the warrior have struggled. The warrior are still struggling to make sure that they protect themselves from the COVID. At the same time, to make sure that their blood sugar is not way above normal. So many things might go wrong. Many things did go wrong before. So we are still trying to cope with it so that we can be safe. And about insulin and other necessities, it is hard to get insulin in Tanzania. We don't have the short acting to some of the clinics. We don't have the intermediate acting to some of the clinics. And when it comes to strips, that is the worst because we don't get them from the hospital. You have to buy them. So buying almost everything so that you can be safe, so that you can live to see the other day, it is not good. It is the worst. It is the worst thing we have seen right now. So we are still struggling and we are still trying to protect ourselves from the pandemic. At the same time, we are still struggling to get our insulin because, as you know, no insulin, no life. Thank you.
Hi, my name is Janice Ohome. Living with diabetes for 9 years. Okay, some of the challenges that we have faced during this COVID period is one, the government has prioritized COVID over other conditions, whereby COVID comes first before any other conditions, and this has been quite a challenge to people living with diabetes, to be specific, and it has really affected most patients because accessing insulin has become hard. Its availability is also not that reliable. Also, most patients are scared of going to hospitals, which is the main place where COVID is. So most don't go for their regular checkups, follow up, which ends up affecting one's condition. Also, transportation has become a problem because due to the COVID rules, the number of people in one vehicle have been reduced. Hence, the transportation fee has become way more expensive than it was before COVID, and most people cannot afford that kind of fee. So most don't go for their insulin. Most don't go for their checkups, which may lead to complications. Also, there's the problem of strips and insulin not being available because of some restrictions at the port, because during this COVID period, cargo coming in was really strict, and also as much as it could get to the place, getting getting to different areas was difficult. Yeah, those are the main challenges I